afternoon, everybody. Jim Fleeler coming to you from Ontario, Canada, Friday, November the 6th of 2020. Thanks for joining our bi-weekly webinar series that we've continued to do actually since the beginning of March. And we got some exciting plans coming in the near future as well that takes us right through to the new year there. So stay tuned for those, all in the interest of helping you lower the risk of an outbreak in your facility. So special guest today, Rita Soares, who's the manager of environmental services at the Toronto General Hospital, a world-renowned hospital in Toronto, Ontario. And stay tuned for that. That's at the end of this, and it's an exciting interview with her to help you lower the risk of an outbreak in your facility. So my name is Jim Fleeler. We're getting new registrations all the time, so I just spend a couple of seconds here. I've been in the industry about 40 years. Serve as a vice president of Canadian sales for Charlotte Products there. Really learn from you, each one of you that attend in each one of your facilities and things. And it's not just me, it's a whole entire team effort here at Charlotte, really helping you, with cleaner, safer facilities and with lots of deep facility experts across North America, as a matter of fact, to take advantage of there. So and we're just proud of what we actually do. So this week's discussion points, obviously cleaning protocols to lower the risk of an outbreak. And we're going to add a seasonal protection and awareness bit in there as well. So we're coming up November, pretty soon Christmas season. There's lots of talk about influenza now along really with COVID-19. And what are the things that you can do to sort of help yourself there and your families and things? It is bi-weekly. I've already talked about our special guest, Rita Soares there. We're really looking forward to her conversation at the end with Asquith and I. And she'll give you a perspective of the pandemic from a world-renowned healthcare facility in Toronto on what the things they've done and what they've been challenged with there. So we're looking forward to that. So fall and winter seasonal awareness. Doctors are advising us all to get the flu vaccine, and they're advising us to do it very soon, as fast as we can, because there will be possible shortages of that vaccine. So we encourage you to get that for sure, now more than ever. Even as in this morning's news, they were talking about shortages there. So heed that advice and really go get it. You really owe it to yourself and your family, your co-workers, anywhere that you're in contact with people to actually do that. It's very, very critical that we all protect ourselves by wearing a mask. You're going to see a little bit of a video shortly here. A mask is probably one of your easiest, least expensive, best lines of defense for you to take. And not only it protects you, okay, because you're a very important part, there's no question, but protecting you is critical, but also those that are around you, right? And that's what a mask actually does. And I know me in the beginning, it was a little awkward to wear a mask, a little strange to wear a mask. Once I found the right masks to wear and things like that, and now it's just second nature, actually, as a matter of fact. And I don't see them going away anytime soon. Thanksgiving, Halloween, the election, Christmas, all could be critical tipping points. Really, the advice there is social distancing, washing your hands, wearing your mask, and things like that. And there's rumors right now indicating a potential trilogy of the pandemic. Trilogy is 1, 2, 3. We're really hot into 2 now, which we sort of predicted 2 earlier in about April or May, and now they're talking about it going into 2021. So take those rumors, don't take them lightly there. The supply of disinfectant shortages is on the horizon again. We utilize predated orders and planning properly. There's a serious red flag coming about the shortages of some of the quats that make your disinfectants for all types of facilities across the world. That's one that they're talking about is in short supply. So, just heed that warning without question. The other thing, too, is public fatigue is obviously setting in. People are a little less patient than they once were. I know it's affected immediate ones around myself and our family and things. But what I see out the window when I'm in the house on the weekends and at night and whatever, looking out the window, there appears to be a lot of neighborhood gatherings, right? We've witnessed witnessed that, strange cars in driveways, all kinds of coming and going and things like that, and activities in the house, on the lawn, the back lawn, all of those kinds of things. That is not what scientists and doctors are telling us to do. The fact they're saying if you don't live there, don't go there, and that's as innocent as how it can be spread with one person visiting there. Hand washing, masks, limited contact outside your immediate family are key to slowing the virus. This is a statement just as fresh as this week from Dr. Theresa Tam, who's with the Canadian government there, and she's a renowned and an expert as far as health and safety and medical, topics and things like that. Every little thing that you do could impact the spread of COVID-19, either right or wrong, or to a benefit or detriment there, and especially over the long winter months, because that's really the concern. When the snow hits and we all go inside and others start gathering inside and we don't practice social distancing and things, that could be a bad thing, because the virus inside a building can spread a whole lot easier to others than it can outside. Both are still risks, but inside is an issue, and that's what we're talking about. A reminder, as always, still today we get hundreds of questions about how do we properly use a disinfectant, okay? And you always want to use a registered product, whether you're in the United States or Canada or anywhere else in the world that needs to have an EPA number or a DIN number, and those are found right on the front label. You need to read and understand that label. So in other words, know what the dwell time is, know how to mix it if it is a dilutable product, know that it's ready to use if it's a ready to use formulation, right? And know all of the facts to make it work better for you, to assure that peace of mind that you've addressed COVID-19 and also other forms of bacteria and viruses and things like that. Okay, diluting it properly regardless of the method. I mean, I always mention my favorite little pump up sprayer here. Okay, and whether it's that or a trigger sprayer or a flip cap on a bottle or a mister or a fogger or whatever, regardless of that method, you need to tie in these 5 security elements for proper disinfecting. Okay, always pre-cleaning, removing gross filth. And I know these are things that everybody asks and says, really? Like, I buy a product in the store and I've never read the label directions. And that's where we innocently go wrong. It will tell you, usually if it's a registered disinfectant, to pre-clean surfaces. That means 2 steps, not 1 step, 2 steps. Spray, pre-clean, then spray again, okay, and respect the dwell time and the contact time, and then wipe away or conduct a potable water rinse if it's around food contact surfaces, okay? These are really, if everybody in our planet followed these, respected all of these instructions, we'd be in a lot safer place without doubt there. So heed that advice, okay? Now, a couple of weeks ago, I know we showed a UNICEF video about wearing a mask, which I thought was ideal, and it was in a cartoon format there, and I just thought, well, I'd do our own here this week and add this in here. It's only about 1 minute and 15 seconds, so just let's take a look at this quick and see if you understand the importance of wearing a mask a little bit easier after this. Well, good afternoon, everybody. Jim Fleeler, Vice President of Sales for Charlotte Products in Canada. In the past, we've talked about the importance of wearing a mask, and we've showed our UNICEF video, the cartoon video, which really drove home the reason why you wear a mask with mom and dad and the children at home and things like that. But still, some people don't follow that protocol, and we're just trying to encourage you to do that. So we thought we'd just look at a different perspective here today. This is basically one of the masks that people wear. This is just a bit of an aerosol air freshener, as a matter of fact. And I just want to show this very quickly. If you don't wear a mask, if you wear a mask, I'll do that again. If you don't wear a mask, if you wear a mask, now that's from you wearing a mask protecting others. Let's look at the other side, protecting you. If someone's talking to you, you don't wear a mask. If you wear a mask, very simple reason, critical importance on why you wear a mask. Protect yourself, protect others. Let's help lower the risk of an outbreak for the world. Thank you. That mask, but I mean, that is the importance, right? Today is obviously about wearing a mask and protecting yourselves and others. So I don't want to really prolong that much longer. I think you probably got the hints there to do that. So we hope you found the information helpful today. The webinars are going to continue. Our next one is Friday, November 20th at 1 o'clock EST time. And what we have another special guest there that we have Jackie Bowen, who's the Assistant Manager of Operations at the Simcoe County District School Board in Ontario. She's really a forward-thinking school board and education sector, and we haven't had anyone really in from the education sector. So she's going to really bring us up to speed as to what are the challenges a school board faces and what have they put in place and checks and balances and things like that. So that's coming up on November 20th. And that's one that you don't want to miss, especially if you're in a college or university or daycare or private school or K to 12 of any sort. So with that being said, thank you for joining us today. We're going to switch now to our webinar, our question and answer period with Ask with Williams and I and Rita Soares. So hopefully you'll find this helpful, and we'll see you next time. Thank you. Good afternoon, everybody. Welcome to this week's webinar. It's Friday, November the 6th at 1 o'clock Eastern Standard Time here. And today we're extremely proud to have Rita Soares from the Toronto General Hospital, network there, University Health System, which I've personally known for many, many, many years. Rita, we won't say how many years. And we've had a very good learning relationship together about really what are the challenges of a healthcare network and a hospital, a world-renowned hospital, by the way, group of them, and what can the manufacturer actually provide as far as disinfectants and floor care and slip and fall efficiencies and things like that. So we've had that and respected that relationship with Rita for many years, and it's great that I can really personally call her a friend and really a great customer for many, many years there. So as you know, our customers on our webinar series have been asking us, Ask With and I normally do the open mics with questions and answers that are fielded. And then a lot of people have actually asked, can you bring some guest panelists in? So people from our industry, whether it be a building service contractor or somebody from a national buying group, or from we had an epidemiologist a few weeks ago, as a matter of fact, with the World Health Organization. We had grade 5, grade 8, grade 9 students come in and give us their perspective from COVID and things. And then so today we've got Rita with us there, who really is in charge of supply services with Toronto General Health or hospital, I should say. And it's just a pleasure to have you, Rita. Really value your time, and thanks for taking the time there. So can you take a couple of minutes and maybe tell people what you do?
Sure. So I'm the manager for environmental services at the Toronto General Hospital. Manage around 300 employees. I have a group of 7 supervisors, and we manage all the hiring and training, and also really involved in the new construction that is being built, in part because I'm the one that approves all the flooring that goes into the hospital, because if I can't clean it, I don't want it.
Yeah,
So,
exactly.
and then I also help our buying department, which is Plexus, with all the contracts and setting them up and everything for disinfectants and all the sanitary items. So there's a lot of things going on.
Yeah, for sure. Well, you've done an amazing job for these number of years that I've been working with you, for sure. And thank you for all that you do and your team to make it a safer place. Because now more than ever, I think we can no longer take for granted what it is healthcare networks and hospitals like yours do. I mean, we rely on that. So going into the year of 2020, all about COVID-19, has that changed the hospital in any way?
Oh, for sure.
Yep. Mm-hmm. What?
Daily operations at the hospital is very challenging because of staffing. Because, if we have staff that become positive, then, you're replacing all these shifts, and cleaning protocols have been changed. So we're, updating every day what's going on. So we have to do updates every day with our staff, make sure we train the staff properly with all the new requirements that are coming through IPAC. And everybody that comes into our hospitals too also has to go through a screening process. So we've basically closed down the hospital to visitors, and they got to go through a screening process at the entrances. They're asked a series of questions before they can enter our hospitals. They have to make sure that they follow all the signs. They do hand sanitation and wear their masks, because that's a requirement in the hospital, and also follow our social distancing signs. And because even in the elevators, we had to put up signs to limit the number of people that go into the elevators to help with the social distancing. So it is quite challenging, yes.
Yeah, that's for sure. And do you find the general public are following that the rules of COVID and the preventative measures and things? Do you think they're doing that?
They are, because they're not going to be allowed to come into the hospital unless they like I said, pass the screening. And then they have to put on the mask right at the door if they don't have their own masks, and they have to hand sanitize their hands. And, we keep an eye on them while they're here in the hospital. So if they're not wearing their masks, then we call them out and we say, you know what, you need to put on your mask. Mm-hmm. So
yeah.
The majority, they're very good, because everybody wants to stay safe.
Yeah.
Could I ask this question? If I were to go to your hospital, would I see a difference between now and a year ago? Would I see a difference in the way the custodians work, or your cleaning staff in general, your EVSs?
Oh, yeah, huge difference.
Yeah, well, what would I see?
Well, we have way more staff on shift, because we've got to do a lot more frequent cleaning of high-touch surfaces.
Yeah, what percentage would that be? What percentage?
Sorry?
What percentage would that increased staff be?
I think we've hired about close to 40 additional staff since COVID hit.
Okay.
To deal with all the extra cleaning and disinfecting and making sure, and everybody's wearing masks and proper PPE. We have to now wear face shields in clinical areas. So there's a huge difference of how we used to operate before COVID.
Mm-hmm. Yeah, for sure. And then since, I guess, would it be fair to say that the last major outbreak or health risk was maybe SARS back in 2003? Would that be fair to say? Have we had anything since SARS? I mean, we've had some smaller ones here and there and things like that, but I mean, would SARS be the closest one compared to COVID? I guess that would be my question.
Yes, SARS probably would be the last one back in 2003, and that was quite scary.
Yeah.
But looking at COVID, I think it's worse than SARS.
Yeah, COVID by far, I mean, just by the number of cases and the loss of life and plus the first wave, and we didn't have a second wave of SARS that I know of. I mean, it was a continuous, but look at all of the things that we've learned. I mean, I haven't seen, and I may be speaking out of line here, but I mean, I've seen the government come to the table probably with a little bit more funding and support and things that way. I don't know. That's probably a question for you, best, Rita. I mean, have they come to the table with a little bit more funding here and there for pandemic specific supplies like gowns and respirators and things like that?
Oh yeah, for sure. We've had to increase it because we weren't wearing masks. We weren't wearing face shields. So now everybody has to wear them. So it's amazing the amount of PPE that we're going through is outrageous in this hospital. Like, it's thousands and thousands of dollars that we're spending on just PPE that we never had to spend in the past. So yes, the government has helped out and has given us funding for those kind of things. And also too, we had to do increased cleaning. So, they had to also provide additional funding for that as well, because our budget just couldn't support it.
Yeah, for sure.
Have you witnessed any shortages in anything of supplies, cleaning supplies or PPEs or anything of such nature?
So I believe that most of our hospitals downtown, any hospital, has gone through a shortage of toilet paper, paper towels, hand sanitizers, disinfectants. But we've been extremely lucky that we have a great buying department, and our manager from our receiving department was able to source substitute products for us. So we haven't run out of anything, and we were able to keep operating as normal. So they've been super, and working day in and day out to get us these products. It's not been easy, but we've been able to source other products to replace what hasn't been coming in. So,
yeah. Yeah, for sure. And shortages. I mean, I know from a manufacturer standpoint, I mean, we've had to do, we've been in fairly good shape as far as supplying disinfectants and, the peroxides and quats and sodium hypochlorites and things like that. But we've had our challenges too. But I mean, it's all about, I almost felt like a stockbroker back in March and April by, allocating, because we'd have a communication meeting every morning, and production would say, okay, you have so many liters to go around. Who do you want it to go to? I mean, and that was a tough thing, trying to prioritize. And we always prioritized healthcare. That was obviously our mandate. That's the most important. Not that any are less important, but obviously healthcare is right up there, for sure there. So a learning curve for sure. Do you think anything else? When do you think SARS will go away? What do you foresee? Or sorry, not SARS. I'm looking at SARS at the same time on the sheet.
Well, yeah, you thought it right, Jimmy. Basically SARS-CoV-2.
Yeah, well, actually, yeah, I guess that's right. Well, that's a good rescue for me there. But what do you foresee in the future, Rita? What are your experts telling you around the hospital as to what to expect and when they think it'll go away or reside or start to lower or whatever? What do you think there?
Well, the way things are going with increased cases, I think we're going to have COVID into 2021. And hopefully we're going to get a vaccine that this will soon be a memory like we had SARS.
Yeah, yeah.
But it doesn't look very good right now.
Yeah, because that curve, I mean, and they said it was coming. I mean, everyone's been watching our webinar series, thousands of people across the world. We've been predicting since probably, I guess, Ask with May, probably area that there was going to be a second wave, and some people go, oh, no, and whatever. But generally the public has not done their part, and as simple as just wearing a simple mask, right? Is really what it is there. So yeah, it's hard to say. And, we look at our numbers in Canada, and I mean, after the Thanksgiving weekend, and they predicted this, that, social distancing was going to be a problem. And look, it just seems a little funny that about 2 weeks after Thanksgiving in Canada, the cases are on a major rise. And the one that really concerns us is the American Thanksgiving holiday, because that one is just, I mean, the numbers are just dramatically higher in population. So they're saying that between that and the election, I guess, not to get into politics, but it's going to be a crazy little November and December and January and so on. Definitely there for sure. So have the distributors that we work with or supply, not to mention any names of distributors in Ontario, but have they been able to supply you with the right amount of product or some product and keep you fed as far as that goes over the last year or the last months?
Yes, they've been very helpful, and I'm very thankful that they've been able to source substitute products for us while we go through this craziness. But they've been very supportive, very helpful, so we're very grateful for them.
Yeah,
Yeah.
good. Well, that's great to hear for sure. And then we have shortages now of pandemic supplies, gowns, respirators, masks, all of those things, gloves, hand sanitizer, all of these kinds of things. I mean, and is it fair to say they're not doing as many day surgeries or whatever from there? I mean, what do you think is going to happen when the hospital opens back up again to these day surgeries and things? Is that going to put a major impact on the network, on the hospital?
Yes, that will impact us, of course, because we did ramp down all surgeries. So, we were, instead of running 21 ORs, we were running 7. So that was back in, March and April and all those months. And then we slowly are back up to full numbers now. But if we have to go back down and stuff, but we are going to see an increase in usage of PPE, of course. But with our buying power that we have in the hospital, we have a warehouse that we have all this extra stock. So we are in good shape. So, thank God, the hospitals are very good right now, equipped with proper PPE and enough to go until, hopefully this blows over.
Yeah. Well, again, I mean, I said congratulations in the beginning on your professionalism and your capabilities of your team. I mean, there's a perfect example. I mean, another inventory amount that's sitting there waiting to go, and utilizing the government supply and the whole works, and surrounding yourself with good suppliers. That's really what makes it tick there for sure. Ask with any particular questions for Rita.
Well, I was going to ask Rita, what type of disinfectants are you using in the hospitals in terms of the active ingredients? Are you using more quartz? Are you using hydrogen peroxide? Are you using, hypochlorous acid? What exactly are you guys using now? There's, SARS-CoV-2.
The hypochlorite is what we're using right now.
Yeah.
Because it has a high kill rate. Fast
Mm-hmm.
kill rate. So we want to make sure that we keep everybody safe, and our staff are well trained on how to use the products. So, because we're constantly training, we're using IPAC, we're doing in-services, we're even using our suppliers to do extra training as well, which are suppliers and distributors to come in and do extra training for our staff. So our staff are well prepared and know how to use the disinfectants properly. We're also, making sure that when a discharge happens from a COVID room, that we have extra protocols in place now. Our supervisors are auditing the rooms and making sure that everything is 100%. And if it's not 100%, we re-clean the room, and then we inspect again, and we have to ensure that room is 100% before the next patient is admitted, because we want to make sure that next patient is going to be safe. So it's a lot of team effort and teamwork, and to ensure that everybody stays safe.
Okay, good. Thanks for that.
And then discharging the patient too. I mean, letting them back out into the public. I mean, you have to ensure that they're safe as well. So the both protocols are as critical for sure. Now, what about your cleaning staff members themselves? Are they feeling fairly confident with the preventative measures in place? I mean, I'm sure there's probably a few hiccups here and there, but are they, I mean, with the ramp up in training and things, are they feeling better about what they do and, as far as safety and also the importance, right? I've always said we never thank the cleaning staff near enough as what we should have been for the last 50 years or so. Have you ramped that up at all? How are they feeling right now?
Well, to be honest with you, in the beginning, they were quite scared because this was something new for all of us.
Yeah.
So, we had to do a lot of training. We do a huddle every morning to make sure that everybody's okay. Any questions that they have, anything that's changed with PPE, any standards that have changed. So every day we're doing huddles with them. Like I said, we utilized our IPAC, which is our infection control. And they did in-services for our staff, which helped them a great deal because they had a lot of questions that they needed answers for, and sometimes we couldn't provide those answers. So we did a lot of those in-services, and the staff now feel quite comfortable that they work, along with our patients. Up to now, thank God, nobody has tested positive. We're really in good shape. When one of our other hospitals had an outbreak for COVID, we were actually sending some of our staff over to help with the other hospitals, and they were quite comfortable going over there, and this was for COVID. So that just shows you right there that the staff feel quite comfortable, and they're putting into an outbreak situation, and they're still going to go and help and do all this disinfecting and make sure that everybody stays safe.
Yeah, that's key, and make sure when you're talking to them, thank them for us and thank them for the whole worldwide, because I mean they're the first line of defense is really what they are, right? You know, and that's where training and all of the protocol you've got in place and validation and measurement and things like that in place really comes into it there. You know, for sure, definitely there. So ask with another question from you.
Well, you know, I think, Rita answered one of the questions I was going to ask, if you've had anyone come down with SARS-CoV-2. And you answered that, thank God, no one has in your group, at least, not come down with anything.
We're all healthy and good.
Excellent. So, you know, that means that your protocol that you've got in place, is working well.
Yeah, we're doing something right. And we also received lots of emails from our manager, especially Emerge, which is the first entrance point into the hospital for COVID patients. And the manager from there, she thanks our staff daily. She says, you know, they're the heroes that saved them, and, you know, trying to keep everybody safe. She says the place is so clean we can eat off our floors. That's how nice Emerge is. And you know, there's not a lot of hospitals out there that can say that. So I'm very proud of Toronto General Hospital for the way we maintain our hospital and keep it clean.
So as an emergency patient, then one should feel comfortable coming to Emerge should they have an issue.
Oh yes, for sure. We have so many people cleaning. We're cleaning the waiting room chairs like every half hour to make sure that all the dispensers, the washrooms are being cleaned every half hour, just to keep all the bacteria and everything down. So we want to make sure everybody's safe.
Yeah.
Wonderful.
Yeah. How about innovation? Has anything come along in the last 6 months since COVID sort of came on the horizon that could help you with your general cleaning practices? I mean, there's been a few things around about foggers and misters and pump-up sprayers and autonomous auto scrubbers and touchless devices and things. Have you implemented or reviewed any of those programs to help facilitate?
Yes, there's quite a few programs that new things that have come around. But to be honest with you, with COVID right now, we're focusing all our energy on COVID and not really have time, because our day is like completely booked with meetings and making sure that everybody's up to par, making sure that everybody knows what they're doing. So we really haven't had the time to take a look at all those new things. You know, I mean, hand sanitizers that are touchless, we've implemented some throughout the hospital, but other things like, you know, the robots and things like that, it's hard to get into those right now because we just don't have the resources to do it.
Yeah. I guess it's fair to say all hands are on deck now, taking care of the day-to-day, hourly, minute by minute type protocol. And I think the industry, though, in general, will be a stronger industry on the other side. I mean, you don't have any drones flying around the hallways and the patients yet, spraying disinfectants and things like that, do you? Yet? It's going to be interesting. It's going to be interesting what comes out, moving forward as far as efficiencies and innovation and things like that. I know at Charlotte, behind the scenes, this was Asquith's spearheads. This has got some tremendous, innovative solutions that can help out, moving forward. So, it's going to make us all better. It's going to make us all smarter, a little bit more intelligent, a little bit more. Hopefully, and this is my biggest goal, is making sure that everybody understands the critical role that custodians and cleaning individuals play, because that has been downplayed, in my opinion, for way too long. I mean, you think about someone that gets out of bed and comes to work and lowers the risk of an outbreak for the general public. I mean, how do you get a more vital role than that? right? It's just, and I think we need to recognize those people and really achieve. I know what we've done in the manufacturing side is we hired and increased the size of our cleaning team that goes throughout the building. So now there's several people running around the building on a planned cleaning schedule, cleaning, disinfecting all of these surfaces to make it a safer place, signing off, documenting on rooms that have been deep cleaned and safe, and hand sanitizer stations put up and stuff. So what's it done for us? It's made us a smarter company and a company that can be of more benefit to exceptional facilities like yourselves there, for sure there. So closing remarks, Asquith, how about you?
Well, I just have to say ditto as well. I'm agreeing with you 100%, Jimmy. And Rita, thank you very much. We always close off this thing by saying, continue to wash your hands, practice social distance, and do all the things that we need to do to keep each other safe. Wear our mask, et cetera, et cetera. I'd just like to take this opportunity, Rita, to thank you for spending this valuable time with us and to share your experiences with all our customers and all our friends and all of us. So thank you very much.
Yeah, Rita.
My pleasure.
Yeah. It just, I want to thank you personally, as well. One thing we've done at Charlotte is all about knowledge transfer and industry awareness, on how people can really lower the risk of an outbreak, and having expertise like yours, proven expertise over, the good and the bad and everything that's gone on for this last several years, the going through SARS and things. I mean, you're just a tremendous asset to us in Canada, and the hospital is certainly better off with you there for sure. And thank you for always being intrigued with new technology and new ideologies and things like that, and working with us, for sure. So we look forward to coming out there. So this will go. This webinar series goes worldwide. People from Europe and Asia, from the Caribbean to the United States to Australia. I mean, this is there's hundreds and thousands of people that actually are watching this, which is great. And if they get one good thing out of this interview, then that's our job is really that's good for us. Our job is done for sure. So, and they'll get many more ideas out of this. So again, from us at Charlotte, thank you very much. It really means a lot to us for you to come on and take time, as Asquith says, out of your valuable day. Stay safe for sure. We're here for you anytime you absolutely need us, and thank you. Make sure you pass along our thoughts to the board team and gratitude, because they are doing an outstanding job. They should be proud there. So with that being said, we'll sign off now. Rita, thank you very much again, and I'll talk to you in the near future for sure. And stay safe.
Okay, thank you.
Rita.
Thank you.
Thank you.
Yeah.
Bye.
Bye.
Cool, and then I'll cut it off. Yep.
Yeah.
We'll trim that.
Okay.
Thank you.
Hi, Rita. One quick thing. My mom worked at TDH for 25 years, and my sister's been there now for at least 30.
Oh,
Really?
Yes.
Really?
Yeah.
my
You told me that, Asquith. You
What
never
department?
told me that.
Oh yeah, my mom worked in Central Supply many years when I was a kid going to school, high school, and so on, until she retired in 1992, 93.
Oh, well, Rita and I weren't even born then, so we wouldn't know her,
Well,
no, you're wrong. I was already working at Toronto General. 38 years, Jim.
Rita, you've got to learn to deny all of these things. Yeah.
I'm trying to retire, and my boss is saying no.
You cannot retire. That's for sure. Asquith can retire, but you and I cannot retire. That's
Oh,
for sure. Yeah. Okay. Anyway, well, thanks very much, Rita. I'll let you go. We know you got other things to do that are more important than us, but again, thanks very much.
okay.
Thanks, Rita. Right. Bye-bye.
Okay.
Bye.
Bye.